The name of the test we are completing is the Function in Sitting Test, or the FIST. The purpose of this test is to evaluate a patient's sitting balance. The test consists of 14 items that challenge the patient's sensory and motor systems and reactive and anticipatory strategies. Scoring is based on a 0 to 4 scale. A 4 is obtained if the patient is independent in completing the task, a 3 if they need cueing and/or take more time, a 2 if they need upper extremity support, and a 1 if they need assistance, and a 0 if they need complete assistance. The standard patient position should be maintained throughout the test. The patient is seated at the edge of the bed with half of their femur supported and their hips and knees flexed to 90 degrees, with their feet flat on the floor and their hands in their lap. The equipment required for this test includes a stopwatch, tape measure, and a small lightweight object.
Hi, my name is Brianna. I'm a student for the therapist at St. Paul. Can you confirm your name and your date of birth for me?
Yes, Stephanie Rivera, 1986.
Okay, nice to meet you, Stephanie. So today what we're going to be doing is a test called the FIST. It stands for the Function in Sitting Test. And what it's going to do is just assess your sitting balance. It's going to involve doing a couple activities. I'm going to be pushing on your chest and your shoulder and your back a little bit and picking up objects off the floor. Do I have your consent to work with you?
Yeah.
Perfect. All right, Stephanie, so we're going to start the test. So I'm just going to make sure you're in the proper position before we start. So I'm going to have you scoot forward a little bit in the chair. I want half of the leg on the surface. And we want you to try to maintain this position for the entire test. So your ankles, your knees, and your hips should be at 90 degrees, which right now you look perfect. So I just want to remind you, I'm going to be giving you a couple of nudges throughout the test. I won't be giving you any warnings, so I'm giving you the warning now. So we're going to start. So, okay, good. So that was a good reaction. For the next part of the test, we're going to have you sit for 30 seconds. So I'm going to time you. You're just going to sit with your arms in your lap. And doing great. Halfway there. Good. All right, Stephanie, so the next part of the test, I'm going to have you sit with your eyes closed, and you're going to remain sitting still with your hands in your lap, and I'm going to time you for 30 seconds. Go ahead and close your eyes. Great stuff. Good. So now what I'm going to have you do is you're going to remain sitting steady and tall without using your hands unless you need them to help you keep balance. When I tell you to, I want you to look to the right, keep sitting straight, but turn your head looking to the right. And you're going to keep looking to the right until I tell you to look to the left. And then you're going to keep sitting straight and turn your head to the left. Keep your head to the left until I tell you to look straight. Does that sound clear to you?
Yes.
We're going to have you look to the right. Good. And look to your left. And look straight. Good. Okay, so for the next part of the test, I'm just going to demonstrate it to you. So I'm going to sit next to you. And what you're going to do is you're going to lift your uninvolved foot 1 inch off the floor, just like that. And you're going to do it one more time. Okay, so you're going to do it twice. Go ahead and try that. Perfect. Alright, Stephanie, so the next part of the test involves us using this object. I'm going to be placing it in different areas and you're going to be reaching around to grab it. So to start out, I'm going to be placing it behind you. And I want you to reach behind you with your dominant hand so you grab the object. Good. So now I'm going to have it in front of you. I want you to try to reach forward as far as you can while maintaining your balance in the chair. Good. Now we're going to do it to the side. You're going to reach to the side as far as you can. Maintain your balance. Good. Okay, so for the next part, I'm going to place it right between your feet, and you're going to reach down and pick it up with your dominant hand. so for the last part of the test, it's going to involve you doing some scooting in the bed, so I'm just going to demonstrate for you. You're going to be sitting, and what I want you to try to do is scoot backwards 2 inches, scoot forwards 2 inches, and you're going to scoot to the side 2 inches. Go ahead and try that. Try not to use your hands as best as you can.
The fist is important for patients with challenges in sitting balance, those that are wheelchair bound, as well as those that are in the hospital to determine if it is safe for them to continue on to standing and walking. The fist has been used with various neurological populations, including multiple sclerosis, Parkinson's disease, spinal cord injury, stroke, traumatic brain injury, and vestibular conditions. There is no official norm or cutoff score that has been established, but this test can be used as an outcome measure to objectively assess the patient's progression.